The graying of America is being reflected in the nation's drug crisis. Even as overdose deaths drop, millions of aging former drug users are living with long-term health challenges exacerbated by their previous substance use. Ali Rogan has our report.
A generation of addicts who grew up during the 1960s and 70s is aging. And whether they have gotten clean or are continuing to use, many are living with compromised health. More than 2 million Americans over the age of 65 have substance use disorders. That's more than a tenfold increase in a decade. And today, many are seeking support from a healthcare system grappling with the unique needs of this population for the first time. We spoke with a number of people in recovery about the health challenges they have faced while getting older, which they say are related to their years of substance abuse.
Hi, my name is Shelley Dutch, and I'm 70 years old.
I'm Mick Heidke. I'm 58 years old.
My name is Kim Hurd. I am 62 years old.
My name is Jerry Schlesinger. I'm 72 years old.
My name is Mark Knox. I'll be 62 years old this year.
I do have liver issues from alcohol abuse.
I've got hepatitis C, which is probably direct use of my intravenous drug use.
I had issues with irregular heartbeats and arrhythmias, poor nutrition, and, fatigue and digestive issues. Headaches were all part of it, nosebleeds.
Because of my drug use, I went in, I had lost 40 pounds and was malnutrition and had neuropathy in my toes. And that has gotten better.
Right now, my eyes are getting blurry, all that. My ears, I have tinnitus, arthritis, and then from the intravenous use, my leg is still messed up.
Being a recovering addict, I don't use any kind of opiates or benzos for pain. I just deal with ibuprofen and handle it.
Just being an addict in general and what I'm aware of, because I'm also a recovery coach, there's stigma.
They seem to have a whole different attitude with the addict than they do with the normal guy out there.
We're not bad people trying to get good. We're sick people trying to get well. And we as adults can go on and thrive and have beautiful lives if we take it seriously and make recovery from any kind of co-occurring disorders a real commitment in our lives.
Julie Wernow is a reporter for the Wall Street Journal, and she's the author of a recent article entitled "A Generation of Drug Addiction Survivors is Entering Old Age." Julie, thank you so much for joining us. We heard just a second ago from, among others, Shelley Dutch, who repeated a 12-step maxim, which is, we're not bad people trying to get good, we're sick people trying to get better. And I wonder, is that a perception that the people you've talked to have encountered when they try to enter the healthcare system and get medical care for issues related to their advancing age?
Yeah, the stigma attached to this generation of drug use survivors is particularly strong. They'll be, possibly going to the same hospital that they've been to 20 times before, and often are sort of treated as if, they're people who can't get better and are sort of just a drain on the system. So often what you'll see is a lot of delayed care because folks just decide, that they're not going to show up anymore to doctor's appointments or to the hospital. And when you get to be, 72 years old and used serious illicit drugs for most of your life, those problems really build up.
And so what kind of problems do people tend to have? Certainly, every person is unique, but I wonder if there are any commonalities that you've come to understand in your reporting.
Yeah, I mean, this is a group just by virtue of the fact that they exist that are really survivors. One of the things that generally complicates their health is that a lot of folks, for instance, who, are using fentanyl on the street have been homeless for possibly an extended period of time or in prison. And often, those situations have, been a big wear on their health in general. You have the kinds of diseases that come about from intravenous drug use. There are folks with hepatitis C who are now dealing with, what's happened to their livers, people who've lost all their teeth. And then at the same time, you sort of lose years of your life to drug use. And so if you're starting over in your 60s or your 70s, there's a lot that you might have missed that the general population learned on the fly over the years.
Is this healthcare system equipped to help these people in the ways that they need help?
The healthcare system right now is overburdened as it is. We haven't really recovered from the pandemic. And so Medicare, for instance, is really playing catch up in terms of being able to provide the same services that you would get, on Medicaid for an older population that might just now be deciding to truly enter recovery from drug addiction.
And because a lot of those people who are entering recovery now are dealing with a landscape that was very different from when a lot of these baby boomer era folks started using, right?
That's right. I mean, when you talk to older folks who are still using or in recovery, they come from a completely different generation. And so it's interesting because sometimes you see a generational gap where people who are both in recovery, but in different generations aren't speaking the same language about that recovery. And I've seen some of that play out as well.
So interesting. Julie Wernow with the Wall Street Journal. Thank you so much.
Thank you.